From your local election headquarters, this is Big Country Politics on KTAB.
Welcome to Big Country Politics. We are here at the Abilene Police Department with Lieutenant Scott Hill. Thank you for joining us today. We're going to be talking about the community response team. Lieutenant, when was this team created?
The team actually deployed around June 10th and started serving the community around that time.
So it's in its infancy stages. So can you talk about the progress of the program?
Sure. We've been up and running for approximately 3.5 months. During that time, they have responded to over 560 calls for service. Over 150 of those have been crisis, immediate crisis responses.
Absolutely. And what does a crisis actually look like?
When an MHID patient is in an immediate crisis, it could be range from a variety of illnesses. During that time, the team will deploy, whether it's through dispatch or they may get a call from the Betty Hardwick Center themselves. Yeah. Or if they show up to do a follow-up call and that patient may be in crisis at that time, then they'll help out as well.
And I know you mentioned Betty Hardwick, but who makes up this team, really?
Right now, there are 3 team members, one uniformed police officer, one uniformed fire paramedic, and a worker from the Betty Hardwick Center.
Okay, switching gears now, I want to talk about the hours of the program. I understand that they're traditional business hours, is that correct?
Yes. Right now, the team runs Tuesday through Friday from 8 in the morning until 6 in the evening. What we've found out through research is that is the majority of the calls, and also that's a good hours for them to do lots of follow-up as well. Absolutely.
And we've actually spoken with someone who's reached out to the the community response team, and he said his husband was unable to get the service he needed through the team because the hours were just a little off for him. But what would you say to that in that situation? You know, what does that person do when he may need someone, but it's not in the correct hours?
Well, if the team is not up and running at that time during a time of need for someone in that specific instance, is they can always call the police department. If it's a non-emergency, obviously they can call the non-emergency number. If it is an emergency, then we encourage them to call 911.
Absolutely. And when this team is going to the scene, what is their first instinct? What are they doing? What are the steps that they're taking?
Well, the first is obvious security for anybody on scene and the team itself. Then it's going to be medical, hence the paramedic on scene. They can provide basic medical steps such as first aid. They can administer any type of drugs that the patient may need, and also obviously they have the ability to take vitals on scene as well.
Why was this team proposed in the first place in terms of providing a kind of service in the key city?
Well, the reason for the team being established was because we received so many calls for this type of service. Whether it is just a follow-up call to prevent individuals from calling in and keeping patrol officers from having to respond, or the crisis itself. So we have seen this model in a couple other cities, larger cities. We actually took the model from the Dallas area to help us create and write our plan here. Mm-hmm. But the need for the mental health is on the rise, and so we decided to, in order to try and reduce the number for calls for patrol officers to respond to these, which is very time consuming, is to create a team in order to try to head off some of these issues before it gets that far.
Absolutely. And how long in the future is it going to take to kind of, I guess, collect data or I guess, monitor the responses to these situations to know whether y'all need to expand or not?
Well, I think those numbers already show that we need to expand. Obviously, you know, I mentioned the hours before when the team runs, but there's also crisis, like you mentioned, when the team is not running. Crisis happens all the time, whether it's in the evenings, whether it's on weekends or not. So we are trying to secure funds for a second team that will run opposite the first team at this point.
Absolutely. And what has just been the response that you know of from the community when the team is coming to these sites?
We've had a very good response from the citizens and from citizens' families who have utilized the service. Actually, I was talking to one of my team members today. They have a client who their family lives in Colorado and has to secure services for people to go and check on their family member while they're here. At the time when they were securing all these other services, they didn't know about the community response team. Once they learned about the community response team, they were very appreciative and actually wants to reach out and try and help the team succeed as well. So there's many stories like that that have come about just in the past 3 months.
Absolutely. All right, well, that'll do it for us for this segment. We will be back in just a few minutes after the break with Scott Hill.